Welcome back. Dr. Peter McCullough, very distinguished medical practitioner based in Dallas, Texas, with specialties in internal medicine as well as cardiology, has been a leading force in clarifying the stakes and the mistakes associated with the COVID virus pandemic and our mistreatment of it. Dr. McCullough, you have been closely monitoring a number of things that have been characterizing our experience under COVID, running everything from, mistreating the disease, denying people medications that would be effective, even, nasal washes, for heaven's sakes, censoring people, and indeed punishing those, including people like yourself, for speaking truthfully about what's going on here. I'm anxious to just sort of get your sense of what most importantly should we not do more of, and what should we be doing instead, especially if, in fact, as we're being endlessly told, there's another disease coming down the path, and another terrible pandemic, disease X, and so on.
The public should not fall into a grip of fear with these news stories. Peter Daszak, who's the rogue leader of the EcoHealth Alliance, these NGOs are a huge problem, from EcoHealth to Gates to Rockefeller, Wellcome Trust. They've become very powerful. EcoHealth Alliance, led by Daszak, who is a PhD virologist, he wants to have a library of biological threats and then countermeasures, including vaccines. Well, in 2020, he published on Disease X that they could use new technology and, in a sense, design a vaccine even against theoretical threats that didn't exist. Now the UK is announcing they have a Disease X lab underway working on this. We can't fall into this grip of fear. I think what we need to do is we need to cut government ties with NGOs. The National Institutes of Health is funding Peter Daszak. He spent over $250,000 of our taxpayer dollars flying back and forth to Wuhan while they were engineering SARS-CoV-2. It's got to stop.
And I guess this is the key point. If they don't stop, we are at risk of seeing, I think, quite possibly new vaccines that are also as deadly or more, perhaps, than the disease they're supposedly curing or protecting us against. And one of the features of this, sir, is, as you know, the idea that in anticipation of these new pandemics, these new, public health emergencies of international concern, as they're called, or even potential public health emergencies of international concern, we have to upgun, if you will, the World Health Organization. We have to make it more powerful, not just in an advisory role any longer, but actually being able to tell us when you have a crisis, when you might have a crisis, and more to the point, sir, what you must do about it. Based on your own personal experience and our national experience with what they did without those powers, is this inadvisable, would you say, in the extreme, perhaps?
It's inadvisable. Trump had the right instincts, and I think this still is his position. Pull out of the WHO. We don't need them. I don't need them as a practicing doctor. They are grabbing far too much potential power, binding by international law. They want dominion over all plants, animals, and humans. Their ability to declare, health, climate crises, agricultural crises. Did you hear closely aligned daughter of Klaus Schwab at the World Economic Forum? She's suggesting that we go into permanent lockdown.
Wow. And they've put, speaking of daughters, John Kerry's daughter into the World Health Organization to run the climate exercise piece of this. But again, to your larger point, sir, if we are going to, essentially submit to the fear that is the principal instrument for making all of this happen, and we haven't even talked about, the digital gulag, as we think it's properly called, it's not just a question of you don't need, as a medical practitioner, this World Health entity telling you how to treat your patients and how you cannot treat your patients. To the contrary, you need them out of the way in terms of this. And that's one of those principal takeaways, isn't it, from what happened in COVID-19? Even with just advisory powers, you were being told by the CDC, by FDA, whomever, that you cannot use, for example, ivermectin. You cannot use hydroxychloroquine and other protocols that you've developed. Is that right?
It's true. The fiduciary relationship between the patient and the doctor was broken. And that's a sacred relationship, just like the attorney-client relationship. These are sacred relationships. We can never have external forces influence these or break these. It led to unnecessary hospitalizations and deaths. My estimate is, Frank, 2/3 of 1.2 million 1.2 million deaths, 6 million hospitalizations of COVID could have been avoided with early multi-drug treatment like the McCullough protocol.
Yeah. You said the fiduciary relationship. Do you mean in a financial sense, or do you mean the patient-physician relationship based on basically the Hippocratic Oath?
No,
the medical practice.
Fiduciary means that one actually has responsibility for one another. It's a very interesting
I
word.
see.
The concept,
not just in the pecuniary sense of the word. I
no,
never
it's
heard
not.
that.
It's not a monetary implication here. And on top of that, the principle is beneficence. Is that it's always for the benefit of the patient.
Yes, and to the extent that other people are mucking about in that relationship, let alone precluding it from being determined by the best professional judgment of experienced practitioners like yourself, there's no end of harm that can be done. And I think that's what we've seen to date, don't you? And just last, very quick question. In terms of these further vaccine developments, based on what we've seen to date, based on the practices of these big pharma companies, is there any reason to believe this will come out better the next time?
No, there should be a complete moratorium on messenger RNA, genetic vaccines. There's never been a vaccine that ended a pandemic. We should go back to traditional vaccine development and then risk stratification, finding the highest group that can benefit, and clearly safety first before they're ever rolled out.
Amen. Dr. Peter McCullough, thank you for your service to our country, sir, in so many capacities, not least your participation in programs like this. God bless you. Keep up the great work and come back to us soon if you would. I hope the rest of you will do the same next time and that you'll go forth and multiply in the meantime.